Okay, let's unpack this. You might be managing your asthma, really diligently, following all the advice, but you still feel just incredibly tired, right? Or maybe your asthma symptoms seem to dance to their own beat, really unpredictable. It feels like there's maybe a missing piece to the puzzle, something you just can't quite, won't put your finger on.
Yeah, and what's truly fascinating here is how sleep, it's this basic human need we often just take for granted, how it can either be your biggest supporter or maybe surprisingly your biggest enemy when it comes to managing asthma. So this deep dive, using insights from the Asthma Friend blogs, is really about shining a light on exactly why that's the case. Our mission today, really, is to give you a clear shortcut, understanding what sleep apnea actually is, how it really does impact asthma, what getting diagnosed looks like, and how treatments like CPAP can honestly be a game changer. Ultimately, we want to help you breathe easier and, well, sleep better.
Okay, so given how, subtle these symptoms can sometimes be, what is sleep apnea like at its core? And why is it so easily mistaken for just, I don't know, bad asthma nights or general tiredness?
Well, put simply, sleep apnea is it's a pretty serious sleep disorder where your breathing literally stops and starts again over and over while you're asleep. It's not just loud snoring, these are actual breaks in breathing. The most common type, and the one we're mostly talking about today, is obstructive sleep apnea, OSA they call it. This happens when your throat muscles relax, maybe too much, and block your airway. There's also central sleep apnea that's more of a brain signal issue, and then mixed, which is, a bit of both. But what makes it so tricky for people with asthma is that the symptoms look so much like what you might already blame it on your asthma. The loud snoring, waking up gasping, morning headaches, that awful daytime fatigue that just won't quit. You might also find yourself waking up a lot during the night or just finding it hard to focus the next day.
Wow, yeah, that's a really critical overlap. I can totally see how someone managing asthma might just think, oh, this is just my nocturnal asthma, or, I'm just wiped out from dealing with this chronic condition.
Yeah.
Is there like a specific telltale sign that really points more towards sleep apnea rather than just feeling tired or having a standard asthma flare-up?
That's exactly it. That's why it gets missed so often. The Asthma Friend blogs really emphasize this point. They shared stories of how, before diagnosis, things like being incredibly tired and struggling to breathe at night were just automatically put down to nocturnal asthma.
Mhm.
The specific sign, though, that should really raise a red flag, especially if you have asthma, is that loud, persistent snoring that's clearly interrupted by pauses where breathing stops, often followed by a kind of gasp or choke. Your partner might actually notice this before you do. Recognizing these subtle but distinct signs is just crucial for getting diagnosed promptly because there's this deeper connection happening.
Right, so it's not just feeling tired then, is it? There's a real, biological chain reaction happening that's directly messing with the asthma.
Absolutely. That's a key insight here. It's how the on and off nature of these oxygen drops caused by sleep apnea and the constant little awakenings you don't even remember, how they create this unique chronic inflammatory stress in the airways. It's kind of sneaky, It doesn't always feel like a typical asthma attack. These repeated episodes, night after night, they trigger inflammation not just locally, but systemically throughout your body, including your airways. And it looks very similar to the inflammation we're already fighting with asthma. So it's not just adding fuel to the fire, it's almost like it's changing the nature of the fire itself, making it harder to control. This can make your airways more twitchy, increase mucus, and make asthma symptoms stick around longer, even during the day.
Okay, wow. And if that chronic inflammation is going on, what does that practically mean for someone who's trying really hard to keep their asthma under control day to day?
Yeah.
How does it show up?
Well, it means real challenges. You're probably going to have more asthma attacks simply because of that extra inflammation and irritation. But beyond that, the asthma meds you're currently taking might actually start working less effectively. See, when your body's constantly dealing with low oxygen and broken sleep, its ability to respond properly to medications just goes down. You might end up needing higher doses or maybe even extra medications just to get the same level of control you used to have. And another big thing, chronic sleep deprivation really weakens your immune system. So that makes you more likely to catch respiratory infections like colds or the flu. And those are, as you know, major asthma triggers. Asthma Friend actually shared a personal story about this, noticing inhalers weren't cutting it anymore, asthma symptoms getting worse during periods of bad sleep. At first, they thought, oh, it's allergies, maybe the weather, until their doctor pointed out that untreated sleep apnea was the real culprit underneath it all. And the amazing part, once they addressed the sleep apnea, their asthma control got so much better, and just their overall quality of life improved dramatically.
That story really hits home how important diagnosis is. So how do you actually, go about getting diagnosed? What should someone expect if they need a sleep study?
Yeah, getting diagnosed accurately and in good time is definitely the critical first step. The main tool for this is a sleep study. It's actually painless, not invasive at all. There are basically two main kinds. First, there's the home sleep study. You do this one right in your own bed. You use a simple portable device that tracks your breathing, your oxygen levels, and any, disruptions while you sleep. It's really convenient, often used for that initial diagnosis or just as a screening tool.
Okay, convenient. And then I guess for trickier cases, there's the one in the lab.
Exactly. That's the lab sleep study, or the technical term is polysomnography. You do this one overnight in a special sleep lab. It gives a much more complete picture. They monitor brain waves, eye movements, heart rate, really detailed breathing patterns, oxygen levels, the whole 9 yards. It's super useful for more complex situations, or maybe if the home study didn't give clear answers. The Asthma Friend blog mentioned they actually chose the home sleep test because it was just easier and more comfortable. The setup was pretty simple, just wearing a few sensors overnight. And bam, the results showed moderate obstructive sleep apnea. It suddenly made sense of all the fatigue and the worsening asthma, and that led straight to trying CPAP therapy, and they said they felt noticeably better within just a few days.
That's encouraging. So for anyone thinking about a sleep study, whether it's at home or in a lab, are there any practical tips to make sure they get the best, most accurate results?
Yeah, it's mostly common sense, really. First, try to stick to your normal routine as much as possible beforehand. Don't suddenly change your sleep schedule right before the test. It's also a good idea to avoid things like caffeine or really heavy meals, especially later in the day, on the day of your study. If you're doing a home study, just aim for your usual, comfortable, quiet sleep setup. Nothing fancy. And probably the most important thing, just carefully follow all the instructions they give you for setting up and using the device. That really helps make sure the data they collect is accurate and useful.
Right, makes sense. So once you have that diagnosis, CPAP therapy often comes up. For someone maybe not familiar, what exactly is CPAP and how does it directly help someone with asthma?
Okay, so CPAP stands for continuous positive airway pressure. Basically, it's a machine that gently pushes air through a mask you wear while you sleep. That constant, gentle pressure keeps your airways from collapsing. It's the most common and generally the most effective treatment for obstructive sleep apnea. So, the big question: how does keeping the airways open at night actually help with asthma? Well, by stopping that airway collapse, CPAP therapy really boosts your quality of life and health. It does this by significantly reducing inflammation in your airways. And less inflammation naturally means fewer asthma flare-ups.
Ah, okay, so it's directly targeting that underlying inflammation we were talking about earlier.
Exactly. Spot on. And it doesn't stop there. It also massively improves your sleep quality. Because you're breathing continuously, you stop having those little micro awakenings and oxygen dips. You get truly restful sleep, and that directly cuts down on fatigue and feeling sleepy during the day. Plus, that better sleep has another benefit. It can actually help your asthma medications work better. When your body is properly rested and not fighting constant inflammation, it responds more effectively to the treatments you're already using.
The benefits sound huge, really life-changing potentially. But I imagine getting started isn't always smooth sailing. What are some of the common hurdles people run into with CPAP and how can they get past them?
You're right, there's definitely an adjustment period. Mask discomfort is probably the most common initial issue. Finding a mask that fits well and feels okay is really key. Then there's just getting used to the feeling of the air pressure itself, that continuous flow. And this is super important for asthma patients. You absolutely have to keep the equipment clean. Regular cleaning and maintenance are non-negotiable to avoid any risk of respiratory infections. The Asthma Friends story mentioned they were a bit skeptical about CPAP at first, but they said they felt immediate improvements in energy levels after just 3 nights. That extra energy really boosted their productivity and even their mood during the day. Their main challenge was getting the mask right, but they found that just trying out different types of masks eventually led them to one that worked well.
That's a really practical tip. Try different masks. So for anyone who's maybe struggling to adjust, what other advice do you have to make using CPAP a bit easier?
Definitely don't give up on the mask thing too quickly. Try different styles, nasal pillows, full face masks, nasal masks in different sizes. It's very individual. Another thing is maybe try easing into it. You don't have to wear it all night the first night. Maybe start with just an hour or two, or even during a nap, and gradually increase the time each night as you get more comfortable. And finally, make cleaning a routine. Set up a simple daily or weekly schedule for cleaning your mask, tubing, and water chamber. Keeping it clean is crucial for effectiveness and, especially with asthma, for hygiene to prevent any breathing issues.
Okay, great advice. So bringing this all together then, for managing both sleep apnea and asthma in a sort of holistic way, what are the most important practical steps you'd suggest our listeners take?
Well, the absolute first step, the foundation really, is getting professionally diagnosed and treated for sleep apnea if you even suspect it might be an issue. Don't ignore the signs. Beyond that, trying to maintain a regular sleep schedule can really help stabilize things. Also, pay close attention to your asthma symptoms. See if you can spot any patterns, like do they get worse after nights of poor sleep? Keep a log, maybe. And always, always talk to your healthcare provider about any medication adjustments, especially if you start CPAP or notice changes in your symptoms.
And what about lifestyle stuff? Does that play a role too?
Oh, absolutely. Sometimes small lifestyle changes can make a surprising difference. Things like weight loss, if that's relevant for you, can often significantly improve sleep apnea symptoms. Even just changing your sleep position, sometimes sleeping on your side instead of your back, helps keep the airway open. And just generally improving your sleep hygiene, cool, dark room, regular bedtime, that can be beneficial too. But the core message, the real takeaway here is this. Understanding and actively addressing sleep apnea is so, so important if you have asthma. It can genuinely improve your breathing, make your medications work better, and just dramatically boost your overall quality of life. It really allows you to get back in the driver's seat with both conditions.
It really is eye-opening, isn't it? How interconnected these things are, things that might seem separate on the surface, and how tackling one can create such a positive ripple effect on the other. Makes you wonder, doesn't it? If addressing an underlying issue like sleep apnea can impact something as complex as asthma so profoundly, what other foundational health links might be waiting for you to discover in your own health journey?
Absolutely. So if anything we've talked about today rings a bell for you, maybe you suspect sleep apnea, or you have those persistent sleep problems alongside your asthma, please talk to your doctor or healthcare provider. Don't put it off. And definitely stay tuned. We've got another deep dive coming your way soon where we'll explore even more about this sleep apnea and asthma connection, drawing from the next set of really insightful blogs from Asthma Friend.